Hello and welcome to Health Matters on Channels Television. We're so glad you could join us. I'm Mary Alale Yusuf. Non-communicable diseases are those that cannot be easily passed from one person to another. According to the World Health Organization, non-communicable diseases actually kill about 38 million people every year. Approximately 3/4 of these deaths occur in low and middle-income countries. Cardiovascular diseases, which are conditions of the heart and blood vessels, account for most non-communicable diseases, or NCDs as they are popularly called, causing about 17.5 million deaths a year. My guest is a professor of medicine and cardiology at Babcock University, Ogun State, president and CEO of Tri-State Cardiovascular Institute, and chief, Division of Cardiac Catheterization and Interventional Laboratory at the University College Hospital, Ibadan. Professor Kama Adeleke, you're welcome to the show, sir.
Thank you very much. Thank you for having me.
Cardiovascular diseases, diseases of the heart and the blood vessels, and we are talking about children. How is it possible? We always thought that heart problems, vessel problems were problems of age. But now we're talking about children. When we talk about children, what age are we thinking of?
Well, thank you very much again for having me. The cardiovascular disease are actually categorized into two. We have what they call the congenital, and we also have what they call the acquired. The congenital are the one that actually occurred at birth, and the acquired occurred after birth. Now, if you look at in children, the majority of these cardiovascular disease are actually probably related to both genetic and the environmental. You know, if you look at the number, I would say probably about 90% of those people who develop heart disease is a combination of that.
Even congenital heart disease?
Yes, even the congenital heart disease. So 10% is actually probably all related to genetics. So that tells us how much, you know, the environment plays an issue in cardiac disease, and that goes with the acquired one in the older people as well. So pretty much we can still really blame a lot of the environmental issues and what we do as what we call the modifiable risk factors.
Okay, this is where I'm coming to now. For children who are born with heart diseases, is there anything the parents actually do to sort of encourage such heart conditions?
Yes and no. As I said, genetic is about 10%. So genetic and environmental are probably 90%. Let me take you one by one that. Now, if you look at what are the issues that the pregnant woman face, number one is that the heart is already formed by 6 weeks gestation, done. So
done and finished.
Done and finished by 6 week gestation. So you're talking about first trimester is so important. So really, truly, if you want to have a healthy baby without any heart condition, you need to really start before conception.
Yes, because 6 weeks gestation, she probably doesn't even know she's pregnant.
Exactly. So in other words, once you already know you are married and you are planning to have children, so you have to really start taking precautionary measure, probably like almost by the year before. Because that's what it says. Why am I saying that? Number one, nutrition is an issue. We know there's certain deficiency in, you know, things like folic acid, vitamins, you know, can lead, you know, to some kind of defect. Medications, and people don't do that, you know, intentionally. You know, take for example now, a lot of women, they take birth control pills. I can tell you right now that the progesterone, estrogen are being implicated in future development of heart disease. Alcohol intake, you know, there's something we call the fetal heart syndrome, you know, whereby people who drink alcohol, you know, before, you know, they can. Other form of medication, someone who have seizure disease, you know, that is taking medication like dilantin, for example, now, also have been shown to cause, you know, heart defect. So really, there's so many things that you have to really take care of. And of course, nutrition is a very, very important, you know, paramount, you know, in that case. So you can really see environmentally, you know, we have a lot to do which is where we are going to be talking, what we're going to be talking about when it comes to avoiding, try to really cut down, certain
on heart disease,
and heart disease,
congenital heart disease. Now.
Infection, for example, now, people who have things like rubella infection, people who have, infection, or, viral infection, all those things can get into the placenta, get into the baby, get into the heart, and cause either the defect or even weak heart muscle.
Okay, if mothers were to take heed to what they eat, be careful about their lifestyle before having a baby, and do things correctly, what percentage of congenital heart disease do you think could be cut off? What percentage could be taken off and avoided?
I would say probably, as I said before, because you got to really go by numbers, statistics. Let us say now we actually take environment out completely. Remember I told you 10 to 15% is probably all related to genetics, pure genetics. Then when you add the genetic and the environment into it, then you're talking about, 90%. So you can really, infer from that taking out the environmental factor.
We take out 90%.
Take out a lot, exactly. So it's really, really quite very interesting. Because when you look at, things like diabetes, high cholesterol, hypertension, they are going to relate on the outcome, of your baby. So really, you really need to monitor all those things before.
Okay, you've mentioned fetal alcohol syndrome and some others, but can you give us some of the common heart problems children have, especially in Nigeria?
We are collecting data now. There was a data that I think it was done by Professor Omakodian and Dr. Anima Shaun. Professor Omakodian is from UCH, and Dr. Anima Shaun is from LASO. And I think there's another, professor from the north, which I attended. I was trying to really get their data, and it's quite very, I couldn't really get it, which is going to be the first one I would say that they have collated in years, to innumerable. As far as TRICES is concerned, I would say that we have done probably close to about 120 open heart surgeries since we started officially in 2016. And of those, I would say 60% of them that we did are children. Now, when we look at the diseases that we have seen, majority of them are things like, just a hole in the heart called ventricular septal defect, atrial septal defect, which is the ASD. We have done one that is so common. It's so common that I can't even believe it, because I'm seeing it even in the elderly people, as old as about 50 years old, called tetralogy of Fallot, which is a multitude of different, you actually have 4 different defects in the heart. So, we're seeing quite a bit of those. PDA is very, very common, which is just, a hole between the, big artery and then the venous system. So those are the cases that I would say we have seen a lot.
A hole between the artery
and the venous system.
Venous system.
Yeah.
Okay, now, I imagine that there will be some symptoms for a child. And because a lot of children cannot express themselves, they have to be seen. What kind of symptoms does a child with a heart problem come up with?
Most of the time, the children actually don't have symptoms until it's too late.
No symptoms?
Yes. We tend to really, I used to be a pediatrician. So what we did is that when the kid, back in the US now, in the Western world, we actually pick up a lot of these diseases in utero. In fact, some surgeries are being done now.
Ultrasound scan?
Yeah, just by the high level ultrasound. In fact, some surgery has been done now in utero. You probably heard about the Nigerian, that did one, So we already got to that level. Now, those people who escape that, as soon as they are born, it's mandatory that they have to be evaluated by the pediatrician. Okay, whereby you weigh them, you weigh the placenta, which we're going to talk about later, because it's very, very important. Then you use your stethoscope, to listen to them. During that time, that is when you pick up majority of them, because they have the heart murmur. Once they have the heart murmur, then the next thing you do is the ultrasound of the heart, which definitely is going to give you the full diagnosis, as long as you have some.
So are you saying that most heart diseases can actually be picked up by routine examination in utero in most hospitals.
In most hospitals in the advanced country, but not yet in Nigeria, I do not think. But if you have the, level 3 ultrasound, we call it, we can really pick up a lot of those, yes.
Okay, do tell us about this placenta.
Well, I want to talk about the placenta because placenta is a gateway between the mother, okay, and the child. The placenta is what carries all the nutrients through the blood. It attaches, from the mother into the baby. So whatever the mom eats, whatever the mom take, whatever disease that mom have, they all go through that placenta. So now there's some study that's showing that actually if you look at the placenta at birth, it can tell you a lot of what is going to happen. We don't even look at birth. We look at it during the level 3 ultrasound. We can measure the size of the placenta. We can look at the contour of the placenta. You can look at the structure, the texture of the placenta, which is going to tell you, because if placenta is very small, then you know that that placenta is not getting enough nutrients. Therefore, if the placenta is not getting enough nutrients,
the baby is not getting enough nutrients.
If the placenta is very big, too big, again, the same thing is happening. A big placenta is going to mean a big baby. And now, the study also has been suggested that kids that have low birth weight, because of low, weight, of the placenta, also now are being predisposed or developing diabetes, type 2, hypertension, hyperlipidemia, and then, of course, even coronary artery disease, which you don't tend to really see in baby, but in future when they become adults.
Okay, so they carry that tendency and in the future develop such things. But you see, with all this, shall I say, it's so premeditated, you can find out so early in life, then there are some things that can be done to prevent those things from happening later in life, aren't they?
Absolutely. Absolutely. I don't want to see the kid that we are seeing in our hospital right now, just as you alluded to earlier on. These are the kids that already have the advanced stage. I saw a kid that was referred to me last month. Poorly, this kid is so sad. The kid had gone to everywhere, but had just a hole in the heart, which, right now we can even fix that one depending on the size by not opening the chest. We can do it in the cath lab where you just go through the groin and fix that. We are doing that now. But this kid already got so advanced to the point whereby the kid now suddenly, it is too late because the heart already failed. The only thing can save that kid is a heart transplant. So if you look at the kid, because you also asked me a question, what kind of symptoms? And I said majority of them do not have symptoms. And some will have symptoms. What are the symptoms they're going to have? Either that you just, dyspneic, in other words, shortness of breath. You look at your kid, they're supposed to be breathing like about 20 per minute. Suddenly now breathing 40 per minute. Okay, they are irritable. Okay, or they are sweating profusely, or their heart rate is just very fast. Those are all the things, or they are sluggish. Those are all the symptoms that you can see. Very non-specific, but it may point towards the heart disease. But if we really want to change the paradigm of the heart disease in children, I think we really need to go back, from the preconception into the conception. Make sure the immunization are well given. Because think about it, the kids that come out, even though, let's say mom did everything perfectly well, okay, placenta is perfectly well, but the kid unfortunately did not get immunized, okay, and then that kid now go and contract that infection, and now infection now go and hit the heart. It can be infection that's going to chew up the valve. Now the kid is going to have acquired valve disease.
Like a rheumatic?
Like rheumatic, thank you. Endocarditis we call. Endocarditis, for example, now can occur. Most of the time you occur just from tooth decay. Just ordinary going to see the dentist is a big thing. Bacteria.
Doctor, I'll have to cut you there. We need to go on this break, but when we come back, you'll continue. Please stay with us. We'll be back really soon.
Thank you.